am here to present as a glossary the new terminology of nascent geographic atrophy. And a lot has been spoken already, but traditionally geographic atrophy, as we already saw the definition this morning, is something we have described as more than 175 microns, and this is clinically visible or visible on a fundus photograph. And the term Drusen related atrophy is a loss of RP and ISE bands, which results in an increased signal transmission below the basement membrane with the loss of external limiting membrane or the outer nuclear layer in this area. So if you look at these two images, this upper image is which could be called as geographic atrophy. So these are two patients. This is a baseline and image at 27 months of these two patients. And here you can see that there is this increased transmission below the basement membrane in both. And here you can see these well-defined areas on the fundus photograph. So this is probably what would be clinically called geographic atrophy. Whereas in this eye you cannot see it clinically, but here again you have the loss of the external limiting membrane and the outer layers and an increased transmission. So this is probably a Drusen related atrophy. So nascent geographic atrophy is a term which has been brought into by a longitudinal follow-up of patients with intermediate AMD in order to define which areas or which lesions are likely to develop geographic atrophy in the future, more so aiming towards any future treatment modalities which can prevent geographic atrophy. So here if you look, the main two characteristics described, if you concentrate on this area and which is delineated by these lines over here, is a subsidence of the outer plexiform layer and the inner nuclear layer. This can be associated with disruption of the ISE-RP band, break in the external limiting membrane, and traces of increased signal below the basement membrane. And over time, if you see that this particular Drusen is seen to be regressing, and you develop this hyporeflective wedge-shaped band over here, and there's a vortex-like substance which is accumulating in that area with the associated Drusen regression. Sometimes the neighboring Drusens are also seen to regress. Another image of the same sort, here you can see this hyporeflective wedge. You can see this better here. You can also see the regression of the Drusen better. Even the neighboring Drusens are seen to be regressing. And so this is three different eyes which have been longitudinally followed up. If you concentrate on this particular Drusen that the authors have pointed out with this arrow, you can see that over time that Drusen is seen to regress. Here you notice the subsidence of the layers happening. With time there's increased transmission of the signal below. So something over here is nascent geographic atrophy. Here it's progressed to Drusen associated atrophy. So when they looked at these patients with nascent geographic atrophy over time, the two most important factors was a presence of NGA in the fellow eye, had 4 times higher risk of developing NGA, and a presence of pigmentary changes was as high as 16 times more likely to develop NGA over time. So here this is again another image which explains NGA versus Drusen associated atrophy. So as you can see, you have the hyporeflective wedge-shaped areas with the subsidence of the OPL and the INL, whereas here you have the absence of loss of RP and photoreceptors and a definite increase of transmission of signal below the RP layers. So the authors, the same group, went ahead to do a microperimetry in these eyes, and they found that on an average the area of nascent geographic atrophy had the worst sensitivity in an eye, but in those eyes where there was a definite area of atrophy, those were the points which had a lesser sensitivity. If you look at the FAF of these, so if you look at these, all three eyes have nascent geographic atrophy, but some eyes show hyper, some show mixed, and some show hypo. So it's said that the ones with the mixed AF are more likely to progress. And again, this is the longitudinally, if you look at the same eye of a patient over 42 months, this is at baseline, this is at 18 months when nascent geographic atrophy is noted. You see that it's a more hyper. Over time, it's becoming a mixed hypo and hyper where atrophy is detected. And at 42 months where it's completely geographic atrophy clinically, at that point you can see that it's completely hypo. So then choriocapillary alterations in this area have been studied. So all areas of nascent as well as Drusen associated GA show pronounced alterations in choriocapillary alterations in underlying the lesion as well as in the entire scan. But when they have used varying interscan times, they found that the signal increased as the interscan time was increased. So, this may suggest a flow impairment rather than a complete atrophy.